All right. Good afternoon, Houston community. My name is Brianna Blakemore. I am the PHI supervisor of the Outbreak Management Unit here in the Public Health Science and Surveillance Division of the Houston Health Department. So today I'm going to be talking with you guys about respiratory illnesses and within our vulnerable populations and how to stay safe within the community during the upcoming holiday season and as the season approaches. As we know, the weather has already significantly changed in Houston. The temperatures have begun to drop, and this is a season where we will see a variety of respiratory illnesses. So, as we transition into the fall and winter seasons, it's important that we understand the risk of respiratory infection and how they can impact our health and the health of others. So, within our outbreak management unit, one of the things that we do is oversee the mitigation and prevention of respiratory infections within congregate living settings. That includes facilities like nursing homes, long term care facilities, detention centers, and shelters. These facility types often house a large population of people, so it is important to know the risk factors and how our Houston community can protect themselves. So, due to the structure of these types of facilities, it's important that we understand that how impactful it is that disease transmission occurs in such close quarters. With these large populations, something as small as a respiratory infection can grow into a large number of respiratory infections just due to the close quarters. That is why today I want to highlight how the community can stay safe and help keep our vulnerable population safe as well. So, is it COVID, flu, RSV, or the common cold? The flu, COVID-19, and RSV are the most common respiratory viruses that we tend to see within the coming months. With holiday gatherings, indoor crowding, and the lower humidity levels that we've seen over the last few days, and weakened immunity, it can become a recipe for respiratory infections. So, how can we protect ourselves? If you see here, some of the ways that we can protect ourselves is understanding what we have access to and what our resources are. So many residents within our in our congregate living settings, such as nursing homes, long-term care facilities, are older adults that may have health conditions that may make them more vulnerable to these types of infections. So here we can see how RSV, the flu, and COVID can impact our community and make us sick with a wide range of symptoms. So we also have a QR code located here on the flyer that you can see that gives you access to additional information and resources on houstonhealth.org relative to immunizations and things at your disposal to help you stay safe and keep the community safe in this respiratory illness season. Additionally, by preventing infection, it not only protects our residents, but also the staff, the families, and those who care for them. So you're probably thinking, in addition to that, what can I do to stay healthy and also keep my community healthy? So vaccinations, being able to stay up to date with your annual flu shot, obtaining your COVID and RSV vaccines. And if you can refer to our QR code here, you can get access to many resources relative to vaccinations and how you can go about obtaining each one. Additionally, if you do plan to visit family members and loved ones, whether they are within these congregate living or vulnerable populations, testing is also a great initiative to take for peace of mind and to just additionally keep your family members and your loved ones safe. If you're planning to visit a member in a nursing home, long-term care, or detention facility, just be sure to know your status in terms of if you feel that you are experiencing symptoms, please be sure to, just get yourself tested for peace of mind. In addition to those other ideals that will keep you safe, wash your hands. Always, always, always wash your hands and be mindful of consistent hand washing and the use of hand sanitizer. Also, mask up. If you know that you are going to be in an environment with a large crowd of people. The best way to probably keep yourself safe would be to mask up. Better safe than sorry. So, in addition to flu and COVID, RSV is a very, very significant respiratory illness that we see frequently in the coming months due to the seasons change. So, for resources relative to RSV and how it impacts older adults, those that are within the vulnerable population of a nursing home or long-term care facility, or just your loved ones that fit into that area of older adults, here are additional resources and how you can assist with helping the prevention of RSV. And in addition to the respiratory illness season, as we move into the colder months, just remember that FOMO is normal, but it's better to be safe than sorry. And I promise you that your family members will be way more happy that they're staying safe and healthy than you missing out. Thank you guys for joining us here for the Health Minute, and have a good day.